The Hope Note is a way in which physicians can improve patients' health and well-being by opening the questions during a visit to both conventional, complementary, and lifestyle approaches. I want to talk to you a little bit about, some of the things you've been, suffering from, and some of the conditions, and hear a little bit about that. And then the purpose of this visit really is to talk about things that you're doing that help yourself, that can help you heal. Okay. And so we want to go a little bit into that, and then look at how do those get integrated together, and then where is there good research to enhance some of those effects to improve what you're doing. Okay. Okay, so it's about self-healing, about well-being, and then integrative health in those areas.
Yes. It's been a learning process, learning what I can do and what I can't do, and letting the things that I can't do go. Okay. Because that was a big deal. I love to hike and yoga, and we, go into my garden and work, and I had a hard time not being able to do the things that I loved. I wasn't able to even shower for a week because it was just so absolutely painful that I couldn't shower daily like I used to. So learning how to adjust my life helped a lot.
What about social support in general? How about out of the family? Other family, friends?
I'm kind of an individual that, if you want to call me an introvert, I don't reach out too much.
Let me ask you a little bit about past traumas. Have you had any past traumas in your life? Whether it's been in childhood or other kinds of trauma. People with chronic pain often have that. I'm just wondering if that's something that you've experienced.
I have, unfortunately, yes.
And has it been several times, or has it been...
Several times.
Several times, okay. I'm going to put that in a parking lot, okay, because I know that's a difficult thing to discuss. But often past injuries, whether it's adverse childhood experiences or some other kind of major stressful trauma, that can actually create more problems with chronic pain, or it can set you up actually to fall into kind of patterns of pain centralization. I mention that to you because at some point, you're doing a lot of great stuff here, but at some point we might want to look at, are there ways that you can address that, okay? And because if you can, come to some terms around that, then a lot of times that will also help with the chronic pain, especially the emotional aspect of that. Do you see a counselor?
I do.
You do, right?
I do.
You work from home and also work, right, okay, go ahead.
I do. We're very busy. Our home life is interesting because they don't usually get home. My husband and my son usually travel together, so we usually have dinners that are late, unfortunately. But other than that, I've been very blessed with a wonderful family, a great dog.
Well, what do you do for stress management? Do you do anything specific to try to manage your stress?
I do crafts. I exercise.
So we had talked a little bit about your diet and that type of thing. Tell me what you're doing or how you then address that.
Well, back in May, I was still absolutely exhausted and in pain, and I would get out of breath just walking up a flight of steps or walking from the kitchen to the living room. So I started this new meal plan that I eat 6 times a day, low glycemic, low anti-inflammatory, lots of vegetables, lean meats, healthy fats.
And since you've been on this diet, how have you been doing?
It's pretty much it's changed my life, honestly. Really? Before I had absolutely no energy and no focus, and it was just the days were absolutely impossible. And then I found myself getting more energy where I was actually being able to do things like go grocery shopping without the electric cart. I was actually able to exercise more, get on my bike and go.
I just want to summarize a couple of things that we talked about that I heard that I think, based on what I know about the research and what you're doing, that we can use to sort of enhance your healing. enhance your healing capacity. So one of those was the Tai Chi, the exercise component. We talked about that being important for fibromyalgia patients, and so I would encourage you to continue to do that. I think the route that you're on in terms of the self-care is very likely that you'll be able to at least reduce some of these medications, okay? I don't know if you'll ever be able to get off of them, but the goal here is to integrate the medical treatment with your own self-care treatment, the healing component, to really get an integrative health approach in those areas.